we're going to explain that we're going to change his chest tube. We're going to make sure we have an order. Surgeons are real specific about their chest tube dressing, so I'm giving you the basics here, but sometimes they don't ever want you to open it unless they're there. Sometimes they'll say go ahead and change it if it's bleeding a lot, okay? So I'm going to go ahead and put a towel up underneath here. Got just clean gloves on at this time. I'll try to give him some privacy the best I can, so we don't have extra things on the video. Okay, so we've got the chest tube going. Doesn't look like the dressing is very good, so we're going to have to change that. We want to go ahead and test or look at the drainage box. We want to make sure that all of our connections are good. There should be a zip tie on every connection. So we're going to come on down. This should be up on the bed, and it should be kind of looped so that that it's going, the drainage is going down. Okay, so now we're going to look at the chest tube drainage collection system, and we want to first of all make sure whatever the doctor ordered, -40, -30, -20 suction, that is set at the appropriate place. And then we're going to have the suction tubing here, and when that's turned on, this floaty thing is going to be turned on. So remember, with suctioning, for adults, we're always trying to say between 100 and 120, but with this setup, it doesn't matter. What we want to make sure is that this knob is set correctly, and then the floaty thing comes up. Then you know you have accurate suction, okay? All right, so the next thing we want to look for is a water seal. We want to make sure we've got water all the way up to the line. We might see titling, where they're breathing inspiration, expiration, that's normal. If we see bubbling in there initially, that's a good thing because we want the pneumothorax to be evacuating. But after a couple of days, if we're seeing it, then that means there's a leak in the system. And this is a sterile system, so we don't want to see bubbling in this chamber. Does that make sense?
Yeah.
Pneumothorax is made of air, so it's got to evacuate somewhere. So initially, we would expect a little bit of bubbling. But after a while, we don't want that bubbling because then that means there's a leak. Okay, then this right here is the collection chamber. And so we're going to draw our line at the top, wherever it is, and put the time. And so that we're going to be, so let's say somebody came in here at 6 a.m. and it was at 100 mils, and now we are at 160. And so I know for the last couple of hours they put out 60 mils.
Yeah.
If I have 100 mils an hour, then I'm going to call the doctor, because that might mean that something is bleeding. Let's say we had a gunshot wound or stabbing to the chest. They may need to take him to surgery and close that bleeder, because it doesn't matter how much we drain off, more is bleeding in. So they have to, it's more of a surgical situation. Okay, so we're done reading that. So now we can come back, and with our clean gloves, we're going to go ahead and just take the dressing off. And whoever put this dressing on really was not doing a very good job. Okay, so let's take this whole thing off. Okay, so at this point, we could use 4x4s, depending on what we see. We could go ahead, I'm going to go ahead and take off my clean gloves again. I'm going to open some drain. This is kind of the thing that, oh, there's nothing in there. There's nothing in there. So a lot of good that's going to do me. Oh, here we got some. Okay, let's just say we got some in here and I opened them. All right, good. Okay, so now, I also want to open my Vaseline gauze. There it is. Okay, so now I am going to, I got way too much on this table. Okay, so I can take my saline, and before I put my gloves on, I can wet my gauze if I wanted to. Let's say that there's some like blood clots around it, because sometimes it'll bleed that much. Me just pouring saline over this is not going to get that. So I'm going to need to have some wet 4x4s in order to make it work and clean it off good. I also am going to need some dry 4x4s in order to put over the top and to dry it off, because tape will not stick to wet gauze. Okay, so now I can get my sterile gloves on. How many times do I have to put sterile gloves on for you people today? Okay, I really broke sterile technique. I wiped my gloves on the floor. It's a whole thing. All right, so let's turn this around and let's start over. Okay, so I'm gonna pick up, I'll do this one first. I'm gonna pick up my sterile glove. sterilely from the floor.
Oh, technique.
No, that's not right. It should have been under here. Okay, there we go. Now. Okay, got my gloves on. Okay, so now I'm gonna take my wet 4x4s and I'm gonna clean. Now I might have to contaminate a hand if I need to move anything. So I'm gonna go ahead and clean this. I contaminated this hand by touching to the towel. So let's throw this away. And now I'm gonna take another one. And let's go ahead and put it in this hand since it's more sterile, but I think I contaminated again. Touch the towel. Okay, now we're clean. The next thing we gotta do is put a Vaseline gauze. If I contaminate my hands, I need to put another pair of sterile gloves because I'm getting ready to put on a dressing closest to the, opening the wound. So sterile gloves, and now I'm gonna put Vaseline gauze on. Remember, this is full of Vaseline and it's really gonna come out sort of like a strip. And I wanna put it on there like a cupcake, like it's totally, I wanna make it occluded so air can't get through there. So I'm gonna open this up and I'm gonna kind of put it around the outside. And I'm gonna make it kind of like a cupcake so that it doesn't let air through. And it'll be all gauzy and it'll stick real nice. Okay, next I wanna put on these drain sponges. Okay, so I'm gonna put these around the tube on the outside. Now, I think I might do better if I have his arm above. I'm gonna contaminate my hand. I should have done this to begin with and turn him on his side. So that's gonna work a whole lot better for me. Okay, now we just have to put tape over the top. Okay. Of course, it's not gonna stay. All right. So at this point, kind of all bets are off because I've got the drainage, or I've got the wound covered. Of course, I don't want to lick my gloves or anything, but I'm going to put the bed up just a little bit so you can see a little better. All right, I'm going to remove the towel. I'm going to get this out of the way. Boy, I'm having really a lot of problems. How many ways can I contaminate my gloves? Quite a few ways. All right, so we've got one. All right. I'm gonna try this again. Stay up there. All right, I need an assistant. Would you please hold those up for me? Thank you. All right. I think I need to just do this whole thing over from the very beginning. All right, so now we're gonna put the tape on the top here. And we're going to put, I probably would put tape on the bottom underneath it. And then do one in the middle. I think that might be our best bet to have an occlusive dressing. A lot better than the one that was on there, for sure, for sure. This is like an Elastoplast type tape. Really great for chest tubes. Yeah, that looks pretty darn good actually. I want to make sure it's good. You want to make sure you don't get their underarm hair. Then I want to date, time, and initial. I want to make sure that everything's flowing correctly. We can get the towel out. We can reassess the lungs. And make sure that they're breathing okay. Most of the time, a chest tube drain will not cause any kind of respiratory distress because the reason that you're changing it is because they're bleeding. So, but many times in the middle of the night, the doctors won't want you to change, they just want you to reinforce. So a lot of times that reinforcement comes posterior because they're laying on their back, and so the blood's gonna go to the back. So you always want to make sure with chest tubes that you turn the people and look underneath them, because there's been a few times where I looked at it and thought, oh, the drainage is clean, or the dressing's clean and dry, but there's been one little line of blood and the whole underneath their back was full of blood. And so you just want to really make sure that you look underneath them. Okay, so let's reposition Mr. Spezio to where he's comfortable. He really made that very, very difficult for me, so I don't think I'm going to get him anything to drink or eat the rest of the day. Alrighty. Okay, I think think that's all I have to say for that.